Hello everybody, my name is Dr. Carlos Sanchez. I'm pediatric consultant and pediatric allergist consultant in Mediclinic City Hospital from more than 5 years ago. Firstly, my experience was in Spanish during 25 years as the head of department in allergy. So my focus today is to talk about what happened with the cow's milk protein allergy. It's the most frequent and important allergies in the life of a baby, and especially in the first years of life. So we are checking a lot of kids with intensive and more numbers of cases of this protein allergy. So what is happening? Really, the evolution of the humanity is going to have more allergies in the future, and the cow's milk allergy is going to be, in no more than 10-15 years, principal allergy in the life of a baby. It's going to be focused in some symptoms. We can have digestive symptoms, or we can have skin symptoms, or we can have respiratory symptoms. For that, it's important to identify immediately what are the cases that we have to focus the treatment, and we have to apply all the diagnosis tests or the treatment that we can near of them. So what happened about the cow's milk allergy? The cow's milk allergy, we are going to identify, for example, gastroenteritis. We can have vomiting, we can have tummy pain, we can have sometimes diarrhea. It's only the symptom that we can develop in these cases. Or in another problems, we are going to have sometimes skin allergy with rashes. We can have sometimes difficult for breathing. We can have rashes in the skin, and we are going to develop an anaphylaxis. Take care. Anaphylaxis is the worst condition in the life of a patient with any allergy. So in these cases, the only thing that we can do is, the first thing, contact with your normal pediatrician. If it's possible, when you have pediatric allergy, it's going to be better. Second, we can do some tests like blood tests. We can do a skin prick test. Is not necessary to do, because the skin prick test is only to have sometimes false positive when we are checking patients with atopic dermatitis. So in these cases, the best option is, firstly, we can check some tests in the stools, or we can check some tests in the blood. With that, once that we have identified what is the risk allergy, we can apply treatment. And what is the treatment? Okay, in the treatment we are going to have two steps. If the patients are on breastfeeding, the best option is cancel all the dairy products in the mother's diet. But what happens when the kids are on formula or mixed feeding? Wow, then is when we have the problem. In these cases, the best option is to use an hydrolyzed formula. So the essential amino acid is the basic formula milk that we can use in cases that we are having cow's milk allergy.